Now, let me update you on the coronavirus. The US remains the epicenter of the pandemic. It now has close to 3 million confirmed cases and more than 52,000 new infections were reported just on Sunday. Florida is one area of concern. The infection rate is escalating and total infections are now past 200,000. 11,000 of them were reported on Sunday. Bear in mind there were July the 4th celebrations at the weekend, but this beach in Miami, which would normally be packed, was shut. A citywide curfew was also in place. And this is one of the reasons Florida is taking the threat so seriously. Another stark statistic is that its infections rose by 168% in June. Its daily infection rate is above any recorded by a European country at the height of the pandemic. So Florida is right in the middle of this. So is Texas. Cases there have now passed 200,000 and more than 8,000 people were hospitalized on Sunday. According to local media, hospitals may reach capacity within 2 weeks, and there's an ongoing political debate about whether the state needs a stay-at-home order. Next, further west onto Arizona. Infections there are rising rapidly. They've almost reached 100,000. Gyms, bars and cinemas have all been closed until the end of the month, and more than 5,000 people were admitted to hospital on Sunday. There are also concerns in Arizona. Hospitals may reach their limits. Here's one emergency doctor.
It's absolutely terrifying. We're having whole families who end up in the hospital. We had one family with 3 members who were actually on ventilators in the ICU. And you see how it's devastating for the families, the community, and for those of us who are healthcare workers holding their hands in their moments of need. It's nothing short of devastating. It's challenging because our workspaces in the hospitals are totally full, our entire staff. And it takes an entire staff of our team, respiratory therapists and nurses, and even down to our environmental services and admin support to really be able to take care of patients the